Abdominal pain when coughing can be a discomforting and sometimes alarming symptom. It often stems from minor causes that aren't very serious. However, it can also signal more serious underlying conditions that require medical attention. That is why understanding the various causes of this pain is crucial for accurate diagnosis and timely treatment. So, keep watching to learn about the potential causes of abdominal pain during coughing, ranging from minor musculoskeletal issues to more serious conditions affecting the organs in the abdominal cavity. Number 1. Hernia. A hernia occurs when an internal part of the body pushes through a weakness in the muscle or surrounding tissue wall. In cases of a hernia in the abdominal area, a noticeable bulge may appear and can cause pain or discomfort when coughing, bending over, or lifting heavy objects. The most common types are inner groin, outer groin, navel, and upper stomach. Hernias often require medical evaluation because they typically do not improve on their own and may require surgery to prevent complications. Number 2. Urinary tract infection. A urinary tract infection is an infection in any part of the urinary system, including kidneys, ureters, bladder, and urethra. Most infections involve the lower urinary tract, including the bladder and urethra. Women are at greater risk of developing a UTI than men. Symptoms can include a strong, persistent urge to urinate, a burning sensation when urinating, passing frequent small amounts of urine, and pain in the lower abdomen. UTIs are treated with antibiotics, and it's crucial to treat the infection early to prevent it from spreading to the kidneys. Number 3. Muscle strain. Muscle strain in the abdomen can occur due to sudden movements, overexertion, improper lifting, or excessive physical activity. This condition involves the partial or complete tearing of muscle fibers and the associated tissues. Symptoms of an abdominal muscle strain can include pain during movement, swelling, bruising, and muscle weakness. Rest, ice, compression, and elevation are common non-surgical treatments. Severe strains may require medical attention and a longer period of rest to heal properly. Number 4. Pelvic inflammatory disease. Pelvic inflammatory disease is an infection of the female reproductive organs. It usually occurs when sexually transmitted bacteria spread from the vagina to the uterus, fallopian tubes, or ovaries. Common symptoms include lower abdominal pain, fever, unusual vaginal discharge with a bad odor, painful intercourse, painful urination, and irregular menstrual bleeding. PID can cause serious complications including infertility if not treated promptly. Treatment often involves a course of antibiotics to clear the infection. Number 5. Appendicitis. Appendicitis is an inflammation of the appendix, a small pouch that extends from the large intestine. The condition is a medical emergency, and symptoms can quickly worsen if not treated. Typical symptoms include sharp pain in the lower right abdomen, which may initially begin near the navel and then move. Other symptoms can include nausea, vomiting, and fever. The standard treatment for appendicitis is surgical removal of the appendix to prevent rupture, which can lead to more severe complications. Number 6. Diverticulitis. Diverticulitis occurs when small bulging pouches that develop in the digestive tract become inflamed or infected. This condition is more common in older adults. Symptoms include pain in the lower left side of the abdomen, fever, nausea, and a marked change in bowel habits. Mild cases of diverticulitis can be treated with rest, diet changes, and antibiotics. Severe or recurrent cases may require more significant medical interventions such as surgery. Number 7. Kidney stones. Kidney stones are hard deposits made of minerals and salts that form inside the kidneys. They can affect any part of the urinary tract from the kidneys to the bladder. Often, stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stones can be extremely painful, but the stones usually cause no permanent damage if they are recognized in a timely manner. Symptoms include severe pain in the side and back, below the ribs, pain that radiates to the lower abdomen and groin, and pain during urination. Number 8. Endometriosis. Endometriosis is a painful condition in which tissue similar to the lining inside the uterus called the endometrium begins to grow outside the uterus. It most commonly involves the ovaries, fallopian tubes, and the tissue lining the pelvis. The primary symptom of endometriosis is pelvic pain, often associated with menstrual periods. Although many experience cramping during their menstrual period, those with endometriosis typically describe menstrual pain that's far worse than usual. Treatment options include pain medications, hormonal therapies, and surgery. Number 9. Pancreatitis. Pancreatitis is the inflammation of the pancreas, a large gland behind the stomach that produces digestive enzymes and hormones. Acute pancreatitis is a sudden inflammation that lasts for a short time, while chronic pancreatitis is a long-standing inflammation that can last for years. Symptoms of acute pancreatitis include upper abdominal pain that radiates into the back, swollen and tender abdomen, nausea, and vomiting. Chronic pancreatitis symptoms include upper abdominal pain and weight loss. Treatments range from dietary changes and enzymes to hospitalization for more severe cases. Number 10. Ovarian cysts. Ovarian cysts are fluid-filled sacs or pockets within or on the surface of an ovary. While many women will develop at least one cyst during their lifetime, most are painless, cause no symptoms, and are harmless. However, some cysts can cause dull or sharp pain in the abdomen during various activities, including coughing. Symptoms can also include bloating, swelling, and painful bowel movements. Most cysts disappear without treatment, but larger cysts might require surgical intervention if they cause discomfort or persist. Number 11. Irritable bowel syndrome. Irritable bowel syndrome is a common disorder that affects the large intestine. It commonly causes cramping, abdominal pain, bloating, gas, diarrhea, constipation, or both. IBS is a chronic condition that needs to be managed long-term. The exact cause of IBS isn't known, and it can be triggered by foods, stress, and other environmental factors. Treatment includes dietary adjustments, lifestyle changes, and prescribed medications to manage pain and symptom flare-ups. Number 12. Interstitial cystitis. Interstitial cystitis, also known as painful bladder syndrome, is a chronic condition causing bladder pressure, bladder pain, and sometimes pelvic pain, ranging from mild discomfort to severe pain. The condition is a part of a spectrum of diseases known as bladder pain syndrome. Symptoms include pain during urination, frequent urination, and pain during sexual intercourse. Treatment options vary, including dietary modifications, physical therapy, medications, and procedures to treat the symptoms and improve quality of life. Number 13. Pregnancy complications. Pain in the lower abdomen during pregnancy can be a sign of various complications, which can range from mild to severe. Common issues include ectopic pregnancy, where the embryo implants outside the uterus, often in a fallopian tube, causing sharp pains. Miscarriage may also present with lower abdominal pain along with bleeding. Preterm labor is another serious complication characterized by consistent abdominal pain, which might resemble contractions occurring before 37 weeks of pregnancy. Additionally, round ligament pain is a common benign cause of discomfort during pregnancy, typically arising from the stretching of ligaments supporting the uterus. It's crucial for any pregnant woman experiencing unusual abdominal pain to seek medical evaluation to determine the cause and receive appropriate care. But as you can see, abdominal or stomach pain when coughing can arise from a range of factors, spanning from benign to severe. Prompt evaluation by a healthcare professional is imperative to rule out serious conditions and provide appropriate treatment. Whether it's a simple muscle strain or a symptom of a more complex medical issue, addressing the underlying cause is essential for alleviating discomfort and ensuring overall well-being. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching, have a blessed day, and as always, breathe easy, my friend.